Well, Alejandro,
Yeah.
we got another episode.
Good looking shirt, by the way.
Hey, thanks,
Can I
buddy.
just say, you look fantastic today.
Courtesy of Eric Lee.
I like it.
Good
Branded
friend.
with
I mostly know him as Eric because he's my friend.
the Summit logo and everything.
Dude, he always hooks it up nicely. I mean, it's primo.
Yeah,
Legitimately.
it is.
I don't know
Utah
if I can
brand
say
as
that.
well.
Yeah.
Local Utah brand.
Well,
see it out on the PGA Tour.
Represent. Well, what do we got on the dock today?
This is going to be fantastic. Stick with us. We get to talk to Dr. Todd Pitts, one of our orthopedic surgeons in the clinic who specializes in total joint replacements, and he has some fantastic insight to share today. We get to talk AI, artificial intelligence, machine learning. We get to talk robotics in orthopedics. We get to talk about kind of the culture and the landscape of orthopedics across our country and in our healthcare system. So it's going to be fantastic.
And I think we'll get a little bit into the biologic space, which actually really fascinates me because I do think it's the future of medicine. So
Love it. Let's get into it.
Stay tuned. Oh, here we are.
Here we are again. Who we got today?
We got the world famous Dr. Todd Pitts, orthopedic surgeon. It's been part of our practice going on how many years?
3.5 years.
3.5 years.
Rapid fire.
Rapid fire. Yeah, we can't miss this. Are you going to start?
You go ahead. You had one.
Well, so rapid fire, just kind of get to know you questions. My first question to you is favorite breakfast cereal growing up as a kid?
Golden Grams.
Golden Grams. All right, that's a classic.
What position in soccer did you play?
Depends on the team. Which team?
What's your favorite? What do you like to play?
I was a 9, which is a striker, and then in college I was outside, so I was an 11, outside midfield.
Okay.
It's a position name.
Okay.
Kind of an environment choice: snowy mountains or coastal beach.
Depends on what we're doing and who we're with. If it's by myself, mountains, snow. If it's with the family, beach, because they wouldn't go to the snow.
Good answer.
Good
Love
call.
that.
If you had to only watch one TV show the rest of your life, you could only ever have one thing on TV, what would it be?
Probably Psych.
Psych.
Right.
Okay.
I've heard
Good choice.
that one. I don't know that have you watched it?
No, I've heard of it though.
I've
I'm
heard
familiar
of it
with
as well. If it wasn't orthopedic surgery, then what would it be career-wise?
You'll laugh at this, but carpenter.
Love that.
Kind of what I am already, but
I was gonna say,
really,
yeah.
woodworking, I think, and building stuff is really fun.
Awesome. All right. Well, we'll get a little bit deeper then.
Yeah.
So every kid's dream when they grow up, they say, I want to be a joint replacement surgeon. How did you accomplish your goal? How'd you get there?
I mean, at first growing up, I just wanted to be like my dad, and I didn't even know what he did. So they were like, "What do you want to do when you grow up?" I want to do what my dad does. What does he do? I don't know what he does, but I want to be like him, right?
Yeah.
So he does software consulting, so that was very boring to me. But
But you came of age, you're like, I don't know if I want to do that.
it was really in high school where I took an athletic training class in high school where they had to give you the opportunity to learn how to tape and to, kind of triage athletes, and I was like, this is really fun. And I went with a friend to a high school game that they were covering, and the athlete came off, and I was like, I diagnosed that they had torn their labrum, and the athletic trainer was like, wow, how did you do that? I said, oh, my class. And they're like, oh, you're 100% right. And I was like, oh, well, cool. And it was just by a physical exam. And then I was like, all right, well, now what do we do? I was all caught up in excitement, and they're like, oh, now we send it to a doctor. And I was like, wait, like there's nothing we do?
That's
like
it.
we don't.
Yeah.
So I didn't like that idea of having there's no person that I could be the final treatment. I had to send it to someone else, and so I didn't like that idea that I wouldn't have all the answers. It's not really more of I wanted to be the treater and the top guy, but more of the I want the answer. I want to know how to make that person.
You want to see it through.
So that's what kind of led me into medicine. And then when I went to the University of Utah, the last 2 years of my undergrad, I worked at the anatomy lab. I was a TA after doing the dissections there, and I was like, yeah, the anatomy is amazing, and surgical dissection was just, that was it. So I knew, all right, surgery and medicine, and then I shadowed an orthopedic surgeon in Murray. His name's Dr. John Skedros. He's a shoulder surgeon. He's excellent, and he really shaped me into wanting to do orthopedics. So
That's awesome. And
that's where I
then
went.
you have been outside. We're here in Utah currently, but you've been originally out of the state of Utah. Where were you practicing?
Yeah, I practiced in Abilene, Texas, which is about 3 hours west of Dallas. for 6 years, opened my own practice, kind of did my own brick and mortar thing, and right out of fellowship, and kind of learned how to do stuff on my own and figure it out. And it was the best experience. It wasn't the best experience for the family. That's why we ended up moving, but it was a really good experience. Good people out there just want you to help them, and I really learned, I think, how to care and how to be involved with their care, because that's what they're coming to you for. And I was it. I didn't have a partner to lean on or any tap out. It was like, all right, you got to figure it out. You got to really focus on them. So it was good.
And were you doing joint replacements, purely joint replacements back then, or was that a little bit more broad scope orthopedics?
It was broad scope. They brought me in that area to be a generalist, but as obviously having a joint background was helpful, because there was only one other guy in the area that was joint trained, and so I grew the practice from a general to about 60% joints. I introduced robotics to West Texas. There wasn't any robotics in that area, so that was a big deal, and that really helped us grow quickly.
That's awesome.
In your mind, the landscape here in Utah from an orthopedic perspective, what are some of the nuances in Utah? Anything here that we do unique or different that separates ourselves from the rest of the nation?
In practice or in the environment?
In medicine, in orthopedics. How are things different in the places you've been?
In Texas, kind of where we were in Abilene, the doctors all kind of just manage their own thing. Here it seems to be better lifestyle, in the sense that, hey, when you're on call, you're on call. When you're off, let the people who are on kind of manage the issue. So that's kind of been nice, because we were pretty much on call 24/7 with your patients. And whereas here it's kind of, hey, if this person shows up in the ER doc or the ortho doc that's on call will take care of it, and that's nice. Now, that being said, every time one of my patients does have to go in, I'm usually there anyways.
You want to be the one to take care of it.
It's nice to have that relief valve, so to speak. So that's still a little bit different. Obviously, with the environment here with medicine and the reduction of reimbursement for it, which is significant in Utah. It's about 40% less than what it is in Texas. It leads to a different practice of medicine that I don't love. I'll leave it there.
Yeah.
That's totally fair.
And I'm just kind of thinking about the whole landscape of orthopedics. What are the current trends? Where are things going, or what have you seen evolve over the years that you've been in practice?
Well, obviously the biggest one would be a time in the hospital. Kind of back in the day, joint replacements and orthopedics was, you see it in the old movies where someone broke their leg and they're in a cast and traction up on a bed for weeks. And that was how it was years and years ago. Long time ago. And so it really shifted from kind of in the hospital treatment versus getting him out and moving. And so the pendulum swung from, stay in the hospital for 2 weeks after joint replacement with your leg elevated and not moving and getting blood clots and really having a high mortality rate, honestly, to the opposite pendulum being, let's get him up and get him out as fast as possible and get him moving. Not get him out of the hospital as fast as possible, but just get him back to their normal environment, get him up and moving as quick as possible. And even then, that pendulum's kind of swinging back a little bit to say, okay, let's get them out and get them moving, but let's get them still resting and elevating and relaxing and letting the tissues heal. So it's been interesting to see that pendulum kind of come back and forth a little bit.
And then part of that, I feel like the trend has been, at least here locally, and you can maybe speak to more of a broader perspective, but with what you're doing, as far as I understood, years ago, if you had a joint replacement, you were planning several days, if not a week, in the hospital, like you were talking about. And now anymore, sounds like some of these procedures are at an ambulatory outpatient center.
Probably 90% of our joint replacements are going home the same day. They just aren't needing to stay in the hospital. And for a while there, at the beginning of my practice, it was just overnight. Like, it was just kind of like, hey, you're going to come overnight. And even then, that's just not the case anymore, which is good, because a lot of patients were needlessly staying, and they were literally sitting in their hotel room, twiddling their fingers, going, or what seemed like a hotel room, their hospital bed, literally just sitting around doing like, hey, when can I go home? It's like, well, you have to stay overnight. Well, why? Right. We just get them up and moving and go. So that's definitely changed, which means that we've been pushing a lot more into the ambulatory surgery center for a couple of reasons. Number one, cost. The joint replacements that are in a hospital can be extremely expensive. And so we can streamline that and cut costs and do it in a surgery center for almost more than half in some instances, which is good on the patients, good on the medical community. And then the other thing is they're more efficient because of that, because it's not a hospital where they've got all the different staff and they're on a time clock. So when they go home, they go home. There's no incentive to just go home, get the job done, and get bonus for incentive and quick and different landmarks that are key for that. And so you're able to do a lot more, a lot quicker, and a lot more efficiently, which is again better for the patient, better for the medical community and the environment.
Yeah.
And talking about efficiency, I think about the role of the advanced practitioner and kind of thinking about it in the orthopedic space. What does that kind of look like? And was that there in Texas as well as it is now, or is it different, similar?
Yeah, it's the same. I had an awesome PA in Texas. It was hard to leave him. That was a hard day when I told him I was moving. But we found a great one. Morgan's been awesome. They're essential, and it's hard because they don't, and you guys know this, they don't bring in the money in the OR.
Right.
They bring it in clinic by seeing patients, and so from a business standpoint, they're not efficient in the OR. But for me to get more cases done, Morgan not there is not good. When he's not there, I'm not as efficient because we can, both are doing things. He's closing while I'm getting the next patient ready, and we're able to do overlapping roles, as you guys know, with what you do. And so they're very, very important for efficiency. And then obviously in the clinic and messages that lightens my load and burden. It makes it so that even though patients don't love it when it's like, I have to see Morgan today, I don't get to see you. Yes, however, when it is that you need to see me, or when another patient needs to see me, they get my full attention because Morgan's able to kind of manage the things that don't need 100% of my attention, right? So it really allows me to see more and to really give better face time when I have the face time with patients.
Yeah. And then speaking of that clinic setting, I know there's been a big push in medicine for the artificial intelligence, and people can argue that it's maybe a double-edged sword. That there's some benefits to it, but maybe some drawbacks. What's been your experience so far?
I think the AI software that we have now is a game changer. We'll see anywhere between 40 to 90 patients a day. And you think about that, having to go back and dictate a note, which is what I did in Texas. I had a scribe a little bit. Even then, the scribe wasn't always there. And I would have to spend at least 5 minutes per patient. So if I saw 60 patients that day, times that by 5 minutes, that's how much at the end of the day I'd have to go and do dictations. And that was just more time away from family, more time away from, face-to-face care. And then, coming here, we have a really good program of having PCCs where they're able to help, and they were scribes at first, which has been great. But then again, they're also not classically trained. They don't have all of the different, knowledge base. And so going over their notes was almost more tedious than dictating itself, but it's good because it gave them experience, etc.
Sure.
But with the AI now, the downside is you have to spend a little bit of time setting up the templates. So it takes a few hours on the front end, but it's time well saved. And so I just the other day I had like 90 notes to sign, and I came in here for 20 minutes and signed 90 notes.
That's amazing.
The ability, and it wasn't me just going sign. It was me going, that's 100% correct. The AI got it correctly. So I think it takes away the tedious jobs that are less efficient and difficult for us to make that time up. So from that standpoint, it's good. But I do agree there's some other things that I don't like, that people will come in and say, well, I asked ChatGPT what my knee pain is. And I'm like, okay, here we go.
Here we go.
And it just depends on the input that you give it. It's the same thing with the templates with the AI. If your templates aren't very good, your AI output's not going to be good for your notes. Yeah. And so all that you didn't write down as a patient was talking doesn't matter because you didn't give them a good template. Same thing. Patients are coming in saying, well, I told them I had knee pain and this is what they said I had. Okay, but did you know what to put in? Did you know what to tell it? Because garbage in, garbage out, unfortunately, with AI.
That's totally true.
One thing I just saw, which I thought was fascinating. So we have patient satisfaction scores. How well did your provider take care of you? How empathetic were you? Did they listen to you? And the AI software programs are outscoring the human physicians with empathy and patient satisfaction. What are your thoughts on that?
That's interesting. I think that should be an eye-opener for us if we're not focusing. I would argue that I think the AI has made me more empathetic because I don't get to I don't focus on the computer screen. I literally have my back to the screen the entire time, other than showing them and taking the time to walk through the imaging. I don't touch the computer otherwise. So I think from that standpoint, it's made me better. But yeah, I think there's many different causes for that. I think medicine has pushed us to be more focused on the numbers and not focusing on the patients as much because of the squeeze that it's put on us financially as we continue to receive reimbursements decrease.
Yeah.
Kind of on that thought, though, I have to think about, what does the future look like in medicine, particularly in orthopedics? In your mind, do you see any big pendulum swings going to happen in the next decade as far as how we practice medicine from an orthopedic perspective?
Yeah, I think robotics is becoming more and more key, and it's interesting. This happened in the 40s when they looked at planes and were putting in kind of computers into the cockpit, and they were like, well, it's more instrumentation I need to learn, and it's in the way, and just let me fly. And the pilots really kind of balked against it, saying this isn't necessary. But then since then, we've seen 1,000% drop in morbidity and mortality. I mean, you can't argue with the numbers. And then you'll see pilots that in foggy weather, they are able to land the exact same because of the instrumentation. And so they're, likewise with orthopedics, you're seeing there's two sides. You've got surgeons that are going, I don't need a robot to do a good knee. Okay, that's fine. I don't disagree. You can do a good knee with it. However, the precision and the things that we're able to do with it is in my hands, much better than without it. And I think you're going to see the data finally come out. And we already have data that shows it. And there's some data that says, there's no different. Okay, that's fine. But there is some data that's showing. So I think you'll see technology continue to take a bigger role. Even some of those advocates that are against robotics are now saying, augmented reality. Okay, well, use your same argument that you just made against robotics. Like the same thing applies. I think you're just seeing more and more planning software, more ability for surgeons not just have to go in with a gestalt and a Kentucky windage approach of how to fix and take care of something, but they can actually come in pre-planned and, again, as a carpenter, measure twice and cut once type of an idea.
Do you think they lose that skill set, the new surgeons that are training already having those tools in place?
It's a very interesting point. And there's a lot of discussion that a lot of the ones who are coming out of training that are being trained on robotics aren't getting trained the other direction.
Right.
And I think I agree that shouldn't happen. I mean, you have to know the basis. I mean, luckily I came out, I think, at just the right time in that I didn't train with robotics, and then in fellowship I had the opportunity to pick it up. Yeah. And so when I do a total knee replacement, I'm constantly thinking, okay, this is how I was trained, but with the robot, how am I adjusting it? And then on a couple cases where I don't have the robot, I step back and go, okay, here's what I'm doing with this manual instrumentation. If I had the robot, how would I approach this differently? So in that sense, it's been really good to have that dichotomy of, if I had it, what would I do? If I didn't have it, what would I do? But I do think you are seeing some coming out without the skill set and the confidence to do it without it.
Yeah, that's good.
Kind of the reliance on the AI kind of algorithm to tell you what you should and should not be doing. Yeah. And I think that's where the paradigm is like we talked about in the book club meeting, essentialism, and kind of a lot of things you spoke to is about trying to shift some of the unnecessary workload off to other things so that you can focus on what you're good at. But you do have to have the foundation. Yeah. That's just, there's no questions about that.
That's the whole basis of the artificial intelligence is you have to have the skill set and experience and knowledge to verify what information's coming out of that.
But speaking about planes, I just have to bring this up. When we went on the private plane to watch the football game,
right?
Literally, we got in the plane and he had the sunshades up. And I thought, he's going to pull them down when we take off. He literally kept the sunshades up the entire time. He was completely reliant on the GPS system.
Was wild.
And it was just, I was blown away by that. But it's really I think the direction that we are heading as a society. So we kind of have to jump on board and figure out how to incorporate AI and AI-like technology into our daily lives. So it's really crucial.
Pretty wild that the sunscreen is completely blocked off. And the pilots are on their iPads while we're going hundreds of miles per hour, just thousands of feet up in the air, and nobody's even looking.
But we got there without an issue.
Yeah, we did. We had a good time.
I think some of that goes to the confidence of the pilot's potential. Obviously, don't know them, but I think as a surgeon, and there's a lot of times where I'm, doing the cuts with the robot on a knee, for example, and I'll catch myself looking at the screen more than the knee, and I've thought it a couple times to myself, like, am I reliant too much on this and trusting it?
Yeah.
And then whenever I think that, I always step back and go, but I've done this how many thousands of times, and I know the feel of where the bone is touching, and I can feel that it's matching the screen, so why look, right? Because of the amount of experience. Now, the scary part is, and I've seen this locally, some of the surgeons who are trying to pick it up that don't have that training are 100% reliant, just like that pilot would be. However, they haven't done flights with it down.
Yeah.
And so they're doing it the wrong way. They should have the experience before doing that. And I think that goes back to the training portion. It's so important that those who are coming out, regardless of the technology, are trained on the basics. So if that technology fails or something isn't right, they'll catch it. Whereas I can catch it immediately if I just go, something doesn't feel right, something doesn't look right, and I stop right away.
That's awesome. Well, what's next in orthopedics then? What's coming up?
The biggest one, I think, is going to be regenerative medicine, stem cells, peptides, all the different sexy things that are
We've
being
talked about this before.
about.
Yeah.
The hard part is as you know, with medical studies, making everything standardized and standardized concentrations in the same location where they're getting them, or verifying that the cells are good or peptides are made correctly and things like that. I think once they can standardize that, and with all the research, I think you're going to see a whole bunch of changes that way, which will put me out of a replacement job potentially, which is fine because I'm all in about making patients better without having to cut on them.
Yeah.
I love that.
Well, that's fantastic. This has been awesome.
Yeah.
We appreciate you hanging out and taking some time with us,
Yeah,
Dr.
thanks.
Pitts.
This has been fun.
Tyler, what'd you learn today?
Man, what didn't I learn? You know what? It's always surprising to me just to hear you talk. I think you're very passionate about the robotics technology and how it helps assist you take care of patients, but still just to hear your perspective on how it really can influence outcomes. One is precision care, and I think that's something that Summit kind of tries to model after, is finding that way to just improve patient outcomes. I appreciate your perspective on the advanced practitioner role and how they can help support you, and obviously that keeps us in a job, so job security is always what we're looking for there. But ultimately it's really just to kind of you encapsulate what it means to build a team and the importance of a team in helping patients get to their desired outcomes. So I really appreciate your knowledge and wisdom. I've learned a lot from you over the years, just your willingness to teach and mentor. I've came into the surgery a few times with you and had the opportunity to see firsthand what you do. It's amazing. So for those out there that are interested, reach out to us. I know we kind of have an education platform where we like to reach out to people and hear from other people and what they have as far as knowledge. And so I just appreciate your time. Thanks for coming out.
Great. And then how do people connect with you? Are you out in the world and in the social media world, or how would somebody find you?
Yeah, just with obviously the website and our Summit Institute, Instagram, and all the different things that we do on Instagram with Summit. That's really the best way. I try to stay off social media.
Yeah.
Personally, I don't have my own own account just because I don't want to get into that whole realm. So.
Yeah, of course.
Sexualism.
Yeah.
Cut out the unnecessary stuff.
That's right. Well, you can find our group, our clinic on social media on Instagram, Summit Brain, Spine, and Orthopedics on YouTube, Summit Medical Institute. And then we always like to see people in person every Tuesday morning, 7 a.m. at the Mountain Point Hospital for our in-person discussions, our multidisciplinary case discussions. We always want to give a special shout out to our production team, Dallin and Amelia, taking care of everything behind the scenes. Always appreciate Tyler hanging out here with us, and looking forward to many more things to come. So stick with us on the show. I'm Alex Davis.
I'm Tyler Murray.
We'll see you guys next time.
Peace.
Are you ready for this? Are you ready for this? Are you ready for this? Are you ready?